My feet are amazing. I'm telling you, you've slighted yourself if you hadn't tried this treatment. The laser is wonderful.
It's been great for me. I mean, I'm almost back to my old self again, so it's been really great. And I can play golf again.
Yeah.
But I think within the next week or so, I'm going to be playing golf again.
That's amazing.
Hi, I just want to tell everybody how great this treatment is. When I first came, I was very depressed and I didn't think anything would work for my neuropathy. But after I've enjoyed the treatments, and it has really helped, and I'm showing improvement, and I can feel my toes better than I have in a long time.
And as a whole, it's just giving me new life.
Yeah.
I had severe burning in the bottom of my feet. I couldn't cross my left leg. The muscle in the bottom of my ankle would hardly let me turn my foot. So I have come a long ways in 4 months.
And how long did you suffer before coming to see us?
4 years.
For 4 years.
4 years.
And medically speaking, what do they offer you as alternatives?
They offered me nothing and offered me pharmaceuticals.
Symptoms have dramatically improved, so I feel much better now. And sometimes I don't even think about it anymore.
Yes,
It's been a great treatment.
God just puts me with people to make me feel better.
Just an improvement from almost the second or third treatment with the laser.
Yes.
I could tell a marked difference in the way my legs felt.
I think it was my second visit.
Yes.
I noticed a dramatic change in my feet as far as I could actually go to sleep at night. I wasn't feeling the same sensation. It had subsided substantially to the point where I could get some rest, which I really needed.
Now I don't have to wear socks and my feet are a lot warmer and the numbness is not as bad. I can prop my feet up and the numbness doesn't come in as bad as it used to.
I could not be any more pleased than I am with these people down here giving me the help that they're giving me.
You are at the upper level of nerve damage.
Yes.
And right at the point where it's almost the point of no return if you got any worse. And we're just thrilled because our re-exam just showed that we got a 36% improvement in your nerve function.
And a 36% improvement is awesome because my one leg was already up at 84% loss.
Yes.
And if it had gone much higher, you wouldn't even want to treat me. But we took a chance and it's been wonderful.
Yeah.
Neuropathy, I had the itching under the bottom of my feet and across my lower back. It just ached after I had my back operation and my knee replacement. And I was in constant pain, and since I've been coming here, the leg, my right leg below my knee, had gotten like it was almost half asleep. But now it's a lot better. I have more feeling in the whole leg and foot.
It's probably the most transformative modality to come down the medical pathway in the last 50 years. One of an alternative medicine and surgery, a laser by far and beyond of any modality I've ever used in the physical therapy world, this is the best. Who have had treatments for years and they have instant relief of pain.
90% of our patients are achieving almost 90% relief of their symptoms, which is unheard of.
You see someone that has such debilitating pain in their shoulder, their knee, or their back, and 1-2 treatments, and they're 80-90% better.
That technology is MLS laser therapy. From cutting-edge laser technologies, doctors across various specialties have been amazed by its ability to accelerate healing and alleviate pain.
Plantar fasciitis is particularly responsive to the MLS therapy. Also, neuropathy is very responsive, and to the point where we've had patients after one treatment who said they can feel their foot for the first time. It's very impressive.
This laser can do not only pain management, it can help peripheral vascular disease, Raynaud's syndrome, peripheral neuropathy. So its protocols for multiple problems is phenomenal. It's definitely going to change medicine.
It's really extraordinary, and I never would have believed it. I'm a very skeptical individual, and I cannot believe the results that I'm getting with my patients who had been operated on by me and others and didn't get complete relief from their symptoms, and now with the laser are really, really improved.
I put myself under this laser the day after we got it. I did my shoulder and my knee, and that night I realized that I had no pain in my shoulder or knee after one treatment. It works.
How it works is by employing two synchronized wavelengths of light, which transfer energy to damaged tissues at the cellular level.
It was the second treatment, and I walked out of here and I knew that something was different. And I called him back up and I said, "Thanks a lot. I think there may be something to this."
And after going through the different scientific studies, a lot of them out of Harvard, I was intrigued by the impact this light energy has on the cells. And to be able to decrease the inflammation pathway and the swelling on a cellular level, it makes sense that you thereby decrease the pain.
For patients across America, MLS laser therapy has meant relief from often intractable pain, without medication, without surgery.
We brought it into our clinic and we started seeing patient after patient responding with almost too good to be true. You see someone that has such debilitating pain in 1-2 treatments and they're 80-90% better. So it's been really miraculous.
So in a sense, this has revolutionized my practice. Whereas I would have to say, throw up my hands and say, "I'm sorry, there's nothing else I can offer you." We now have something to offer these patients. 90% of them are getting dramatically better. I can sit there and not feel like a failure as a physician, offer them something that has no downside, and these people are getting better. So every day I come to work, I feel like I have my ace in the hole.
Laser therapy uses a process called photobiomodulation to change the condition of damaged tissue by stimulating cellular metabolism, thereby accelerating the healing process. A large convex treatment head can be used to compress superficial tissues, displacing excess fluid and enhancing laser penetration to deep structures. As light pours into the tissue, photons will be scattered, reflected, and absorbed. Lasers operating in the near-infrared spectrum from 650 to 1300 nanometers can penetrate to deep tissue structures. Light that penetrates into the tissue can be absorbed by melanin, hemoglobin, oxyhemoglobin, and water. Energy from these absorption events will be dissipated as heat, generating a soothing warmth in the tissue. The primary target for photobiomodulation is the cytochrome C complex, which is found in the inner membrane of the mitochondria. Cytochrome C is a vital component of the electron transport chain that drives cellular metabolism. As light is absorbed, cytochrome C is stimulated, leading to increased production of ATP, the molecule that facilitates energy transfer within the cell. In addition to ATP, laser stimulation also produces free nitric oxide and reactive oxygen species. Nitric oxide is a powerful vasodilator and an important cellular signaling molecule involved in many physiological processes. Reactive oxygen species have been shown to affect many important physiological signaling pathways, including the inflammatory response. In concert, the production of these signaling molecules has been shown to induce growth factor production, to increase cell proliferation and motility, and to promote extracellular matrix deposition and pro-survival pathways. Outside the cell, nitric oxide signaling drives vasodilation, which improves microcirculation in the damaged tissue, delivering oxygen, vital sugars, proteins, and salts while removing wastes. These mechanisms of action have been proved by over 40 years of laboratory experiments using lasers of minimal power. The recent development of higher power Class 4 systems affords the clinician the ability to efficiently deliver adequate doses of light deep into the tissue to reduce pain, reduce inflammation, and accelerate healing.
Thank you very much. I am more excited about this show than any other we have done this season, because today we are changing the practice of medicine. Now, if you've tried everything to ease your back pain, your neck pain, foot pain, arthritis pain, then this is the show for you. There's a revolutionary cure for pain that few doctors know about, because it's not a new pill or surgery. It uses moving magnets, energy waves that change the way your body copes with pain. Wait till you see what we found. You may not realize it, and you certainly can't feel it, but inside each of us is a raging electrical storm. A biological whirlwind that controls every cell, every nerve, every muscle, every thought. How you experience pleasure, and even how you experience pain. What if you could harness this powerful force field inside of you to feel better, sleep longer, and most miraculous of all, ease your chronic aches and pains? That's the promise of magnetic therapy, which uses the power of magnetic energy to redirect electrical impulses to the areas where you feel pain, so relief and healing can begin. Are we finally on the brink of a whole new frontier to reduce, even erase, your pain? This is pulsed electromagnetic fields. It's pulsing moving energy, much more powerful than static magnets. Here's what researchers say magnetic fields are doing inside the body. Inside this mat, there are electrical coils. And when electricity passes through there, it creates a magnetic field that moves through the body. And it whispers. There's 75 trillion cells in your body. And it goes deep into your body, places where sports screens and heating pads could never reach. For example, down around the spine, where that red angry area is. Now, the magnetic field turns on, and when it does it activates these ions, these charged particles. And there are proteins in there, and there's signals in there, stirs these things up. And these charged particles bring in nutrients, but they also begin to influence things like blood supply. Now, when the blood vessels are going in here, the red blood cells are actually stacked. See, they're stacked like that? They're not supposed to be stacked. When they're irritated, that happens. So when you pass magnetic fields through there, that yellow line, it opens up the blood vessel. It breaks apart these red cells. They're not stacked like coins. So you can get deep healing, better oxygen supply, so the healing process takes place. You don't just feel better, you are better.
I started, I had 3 problems. I had sciatica, I had a knee problem, and I had peripheral neuropathy issues. The first thing that I noticed is my sciatica started to the pain started to subside. Also, the knee started to subside. I'm down to the peripheral neuropathy at this point, and that is probably almost at 90%. But I'm pain-free with sciatica. I'm pain-free with the knee. My golf game has improved. I've got better golf results. I was most improved this year, so that's great. My gait is better. I feel better. I definitely recommend this to anyone.
Right.
And I've also lost 20 pounds as well, which is a yay, yay.
I was highly questionable that you would do me any good, but I have been corrected, and I have gained much better balance, as well as a lot of the pain in my legs is gone.
Actually, my wife brought me in. She come to one of your open house sessions and thought that this would be something that would be good for me overall. I was involved in sports my whole life and had my knees replaced twice and my shoulder replaced twice and one of those kind of things. And I was very skeptical when I went into the program. And it's something that you can't understand how it works, but it works. And you know, it's like getting like where I am here now, it's like getting a deep massage. I mean, it just relaxes you. My balance is better. It cured my neuropathy. I had neuropathy in my hands and my feet. That is gone. I had sciatica. It took some of that, and I'm, you know, now I guess you could say I'm in a tune-up state, so to speak. But each one of the treatment, it's just a great relaxing feeling from that standpoint. It takes away any pain or anxiety or muscle tightness or any of that kind of stuff. I don't understand how it works, but it just stays. I don't need to know it.
Absolutely no side effects, had nothing but good effects. When I showed up, my ankles were swollen twice their size. I had bladder problems. I was leaping up, and every time I turn over in bed at night, I'd leap up and run to the bathroom. All of those have disappeared as a result of our treatment. My neuropathy was so severe in my legs and my feet up to my legs, I had to sleep with a pillow between my knees. That's gone.
And I have sciatica as well, and my feet are sort of trembling and neuropathy.
Have you seen any improvement yet?
Oh yes, very much, very much.
Whether you're interested in one of our weight loss programs alone or our Zerona Fat Loss Laser, lose anywhere from 5 pounds to 105 pounds or more with healthy, fun foods through our doctor-supervised weight loss programs. Call Healthy for Life for your free consultation.
I just couldn't believe what Healthy for Life did for me. I lost over 20 pounds in 6 weeks with real food and my own weight loss coach. With Valerie's help, I finally did it. I feel like I got my old self back.
Start your 6 weeks to a new you.
I recommend Healthy for Life for everyone.
Results guaranteed.
Helping make your life easier. Moms Every Day.
Hey everyone, welcome to Moms Every Day. I'm Amy Parker, and today I'm chatting with Dr. Kirk Erickson at the Erickson Chiropractic Laser Center here in Dothan, and we're learning about peripheral neuropathy. And as mamas know who are caring for aging parents, a lot of times that comes into play with their feet. So tell us exactly what that is.
Well, neuropathy affects over 20 million people in our country. And there's many different causes. Diabetes is the #1 cause, of course. But it starts off with numbness and tingling in the feet, develops into a burning pain. Some patients feel like they're walking on glass. And then when it becomes very serious, they have balance issues. And for an elderly patient to fall and break her hip or her shoulder, now they're in serious trouble.
Right, that's a very big deal. How do you typically treat it here?
Well, it begins with a detailed consultation and a neurological evaluation so that I can determine if I can accept them for care. Because if I do, I have to come up with a tailor-made plan that works for their individual needs. Unfortunately, occasionally some patients wait too long and their nerves are damaged too severely and we can't accept them for care. But for those that we do accept for care, and a vast majority of them, we get significant improvement in their nerve function. Which
That's
is
fantastic.
very impressive for a condition
Right.
that generally speaking is not thought to
And
improve
so
at all.
serious, it impacts all your life, yeah.
So we use a high-powered robotic laser. We use pulsed electromagnetic field therapy, which is very powerful magnetic therapy to treat nerves and damaged tissue. We use a German nerve stimulation machine called a Hakomed. We use vibration. We use oxygen therapy because it's not just important to improve blood supply to the feet,
but the levels of oxygen in the blood to nourish and help the nerves heal.
Right. And that's all done here in your office?
Yes.
That's fantastic. Thank you so much for sharing that. Y'all be sure to give Dr. Erickson a call and he can help you out.
Oh boy, for the last 4 years I have suffered from extreme neuropathy due to a botched back surgery, and I was in pretty rough shape when I found you. And I know now that there is hope and there is help out there for people that are suffering with this neuropathy. There is help.
Well, I've had tremendous improvement in the symptoms of peripheral neuropathy that I had when I came in here.
Now then, I feel wonderful.
It has done extremely well. I've been able to come off the gabapentin because I don't have the burning and the stinging anymore.
I'm able now to walk relatively easily. I can stand for longer periods of time now.
I'm very excited with the progress that we have made since I've been down here. We have really come a long way, especially in the last week, and I would encourage anybody that's in pain and looking for relief to give these doctors a try. They know what they're doing.
I don't ache as much as I used to, and it's just taking a day at a time, and it's getting better.
Teddy, do you remember the first time you and I met? You were laying face down in my waiting room.
Yes.
Because you had fallen. You were on a walker too when you
Yes.
first started with us. Of course, now you're on canes,
Right.
which is showing improvement as well.
I'm looking for the day that I can get rid of the walker and the canes, both of them.
Absolutely.
So if you're having this problem, by all means come and try it. It's well worth it and you will not be disappointed.
I feel so much better than I did when it was started.
Yeah, that's wonderful. Thank you, Billy.
You're welcome.
Well, thank you very much, and I've enjoyed you guys taking care of me.
Well, thank you. I enjoy coming here.
We just love taking care of you.
And I sure thank you for everything you've done for me.
This is state of the art, folks. It stimulates the nerve electrically. It blocks pain. It improves blood flow. This is what the Hakamed does for people. It allows for greater metabolism and healing, and it reduces inflammation. So it's an alternating current between 4,400 hertz and 12,300 hertz that this has this constant intensity for deeper penetration. This is state-of-the-art stuff. See, there's 100 different electrical currents out there, machines. They all have bioelectrical and biochemical effects. But horizontal microcurrent therapy is the best and it's the most state-of-art. This is why it's $25,000 for the machine and not $1,000. When peripheral nerves start to die, they need to be stimulated, and it's the Hakamed that really delivers that activation.
A closer look illustrates how the use of light therapy with infrared diodes can help promote the healing process in the body. At the basic level, all cells in the body have a miniature power plant within called the mitochondria. This is where our cell's energy is produced. The technical term for this energy is called adenosine triphosphate, or ATP for short. ATP is formed from oxygen and glucose, both of which are carried to cells by blood flow. Patients with neuropathy often have decreased blood flow, which means all cells, including nerves, are not receiving adequate amounts of oxygen and glucose. Therefore, the mitochondria cannot manufacture normal amounts of ATP. Nerves, most commonly in the extremities, sense this lack of ATP production by sending pain signals to the brain. In some cases, a lack of sensation rather than pain is the chief symptom, and this is the main reason for falls. Because the mitochondria are very sensitive to light, infrared light therapy can stimulate ATP production in the mitochondria. That is, if the nerves receive glucose and oxygen through increased blood flow to the nerves. Light energy stimulates the release of nitric oxide from hemoglobin into the bloodstream. When nitric oxide is released from hemoglobin, it enters the muscle cells in walls of the blood vessels. The muscle cells relax as the blood vessel diameter enlarges, allowing more blood to flow through the vessels. Increasing nitric oxide levels in the body offers a host of benefits. These can include anti-inflammation. Inflammation occurs when oxygen levels are too low, so increasing blood flow via nitric oxide reduces inflammation. Tissue regeneration. Tissues that need to heal require oxygen, nutrients, ATP, and growth factors. Nitric oxide provides an environment for enhanced healing. The key to accomplishing this? Better blood flow. Pain reduction. Pain occurs when oxygen levels at the nerve are too low. Think of how painful your finger becomes if you wrap a rubber band around it. The rubber band cuts off blood flow, thereby depriving nerves and other cells of oxygen. The pain recedes when the rubber band is removed. Increased localized circulation. Nitric oxide is increased locally when light energy is applied to any specific site. Along with it, blood flow increases at the same point. The net result of light therapy is a cascade of beneficial chemical reactions throughout damaged nerve cells that stimulate healing. This response can be directly attributed to increased blood flow. This enhanced, localized blood flow improves tissue oxygenation and therefore plays a role in the following: improved sensation, which offers better gait and balance when walking; reduced pain, which can allow for better sleep at night, as well as reduced burning and stinging sensation in the extremities; increased oxygenation, which acts to reduce inflammation; and finally, increased circulation, which offers the body decreased wound incidences and shorter healing times.
Do you suffer with pain, numbness, and tingling in the hands or feet, often diagnosed as peripheral neuropathy?
I've noticed a dramatic change in my feet. I can sleep at night now without any pain. I can walk longer, I can stand longer, and best of all, I get to play golf again. That's really great.
My feet used to be so numb that I once dropped a coffee mug on my foot and it left a bad bruise on it and I didn't even feel it. Now, after receiving the laser and other therapies from Dr. Erickson, the numbness is so much better.
I couldn't be more pleased with Dr. Erickson and his staff for the help they're giving me with my neuropathy. They are really caring people and they really know what they're doing.
Hi, I'm Dr. Kirk Erickson. Our team of chiropractic and medical physicians are dedicated to do all we can to help our patients suffering with chronic pain. Call Regenerative Medicine of Alabama to see how our knowledge, experience, and cutting-edge technology can improve the quality of your life.
And welcome back to Talk of Alabama. We're excited to have Dr. Daniel Russo in the studio this morning talking to us about an incredible new device called Pixel 8. So this is interesting. I've been reading about this, Doctor. Tell us all what it's about.
Well, you know, it's really a neat new technology, Nicole. We're always looking for something that, you know, can make people look better without as much downtime. That's what we're all about. And this particular device, Pixel 8, is a combination of a microneedling device that also has radio frequency built into it. So it has very, very fine needles that barely pierce the surface of the skin, virtually no pain at all. This is one of our patients, and they're doing it right now as they do it, and she's virtually got no discomfort. We put a little topical numbing medicine on. There's really not much downtime at all. A little bit of redness right afterwards, but they can get back into their normal activities right away. It usually takes 2 or 3 treatments to get the best effect we can get, but it really is kind of a nifty device because there is no downtime at all with this.
So it's stimulating essentially collagen, right? And then it's helping overall tighten the skin.
That's correct.
So
that's right.
We're looking obviously at some results right here. What a difference!
These are some patients. You can see it on the neck especially, how she had the crepiness on her neck and the laxity in her neck, and it really made a nice improvement on this particular patient. Another patient, that's just, there she is before and after.
Yes.
And it's nice because it's not a huge, big transformation. A lot of patients are scared. They're afraid they're going to look like a different person, and it doesn't. It just sort of takes them back a few years, which is kind of a nice thing without having a lot of downtime.
Yeah, I love that. And you can wear makeup, what, the next day or a couple days after?
Oh no, the next day is absolutely. You can do it on scars as well, and it's helpful to improve scar tissue. And patients that have acne scarring, it definitely can improve that also.
Now, what about something that we can do to enhance the results of that?
Well, that's another thing that we're using, that we've been using for a while also. PRP, or platelet-rich plasma.
Okay.
Patients may understand what that is if they've had some joint problems. Orthopedic surgeons have been using that for years to inject into joints. If you take blood out of your arm and process it, spin it down, we can concentrate the platelets in the blood. And platelets have healing properties and special properties that help us heal, but they also can stimulate collagen production as well. So we take that concentrated platelet solution and we re-inject it into the face, or we apply it on the face when we're doing the Pixel 8 procedure. It helps stimulate collagen. We can use it for other things as well. We use it to help stimulate hair growth. In patients who are losing their hair, you can inject the PRP into the scalp. This picture just shows how the Pixel 8 works. It's got multiple little bitty needles, and as they penetrate the skin, it actually passes a little electrical current which heats up the skin, and also with the PRP can stimulate even more collagen production.
Well, and you know what, it's interesting. It's just as many men nowadays that are wanting to just kind of shave a few years life. It's not just women that are getting this done, right?
No. We do a lot of men as well. Of course, we do some hair restoration, hair replacement for men, but we do that for women too. But we do a lot of other regenerative procedures for men too. It's very, very vogue now for the men to want to do this. It is, especially with the non-invasive things like this.
That's so safe.
Right?
All right, so everybody put on your goggles.
Everybody has glasses, so just for safety's sake, put your goggles on. We're gonna talk to Donna next. And Donna, what is your issue, sweetheart?
I have sun damage. Too much sun, and I have spots everywhere. They just keep creeping up.
Freckles.
Yeah, sort of.
Or age spots.
They're age
right?
spots.
Yeah, so we're using.
To say that.
So sunspots basically sunspots are due to UV radiation affecting the melanin in our skin.
Right.
And it can affect it to such an extent that you can get these dark spots that we call age spots, sunspots, or liver spots, all the same thing. Now, they're not dangerous. You don't get cancer from it or anything like that, but they do distress people because they don't disappear unless you actively get rid of them.
Okay.
So today we're going to use the newest intense pulse light treatment. And this uses, it's kind of like a laser, but technically not exactly, but this uses light to destroy the pigment actually in those age spots. And we actually treated her arm.
You're not damaging the skin further, you're just getting rid of the melanin?
Melanin, yep, we're destroying the age spots themselves. So what you could see actually is we haven't treated her yet, but I'm going to treat her in a second, but we treated this arm earlier today, a couple of hours ago, and it's darker than that side because what will happen is those age spots will actually darken within a couple of hours, and then after about a week or two, the age spots will actually fall off.
Wow, so when you get this done, it actually looks worse, not better, until the age spots slough off.
Yes, so they will darken. That's amazing. Within about 7 to 10 days, you'll look down, and they will be gone. So we're just going to show you how it works here today on her, although we did her other arm.
And this is a painless thing.
Yep.
It just feels like maybe when you're frying oil. if it splatters on you. Feels like that.
I gotcha.
So sometimes you can get just
well,
a tiny
believe
little,
me, that happens to me 5 times a day.
Yeah, it doesn't hurt. Snapping a rubber band hurts more.
Really? So relatively painless, so
Yeah.
really powerful, and then how long lasting, provided you use sunscreen, of course.
Yeah, I mean, when those spots are gone, they're gone.
Wow.
Yeah, so they just fall off and they're gone. You find them in your sheets or on the floor, they're gone.
Wow,
Yeah,
that is wildly dramatic. Look at that.
These are before and afters from the company, so it's not indicative of everybody's results, but you can
Wow.
really get good clearing.
Oh my gosh.
Yeah.
That is
Pretty
very
amazing, right?
dramatic.
Today I'm tackling an issue that no woman wants to admit they have: unwanted hair. So if you're tired of shaving, waxing, and plucking, you may be tempted to try a more cutting-edge approach. There are now new devices in laser hair removal that allow every skin tone to potentially get it. But is laser hair removal safe? Dr. Doris Day is a leading dermatologist. She's been performing laser hair removal on patients for the last 10 years. So how's it different from waxing and shaving and threading and all the other crazy things that women often do?
Well, here's the deal, Dr. Oz. Women, there are parts of the body we just don't want hair to grow. And we spend so much time. It's really a project between shaving and waxing and all the things that we do. And every day in my office, I see the consequences of that. I see ingrown hairs from waxing, razor bumps from shaving. And with the old lasers, they were small spot sizes. We had to put gel on. It took like an hour and a half to do a leg. And it was really painful. The newer technology has come a very long way. We can really control the energy. They're much bigger spot sizes that pulls the hair in, knocks it out, and it's virtually painless. So it's really come a very long way.
I made you a model of what the skin looks like. So let's go in and look, for example, at lower leg hair that so many women want to get rid of. If you look at the skin, you'll notice that beneath the hair, there are the follicles. When you laser, the laser goes through the skin and heats up the shaft and actually irritates and sometimes damages irreversibly at the right energy level the bulbs down there. So with the shaft now absorbing the laser energy and the skin not irritated, you'll begin to slough off the hair. And after several cycles of treatment, the hair may no longer be able to grow, making shaving a thing of the past. But Dr. Day, if someone were to have laser therapy rather than shaving, does it ever grow back the hair?
Well, the FDA says permanence is 2 years, but in my experience, having done this for 10 years, I can tell you it's a lot longer than 2 years. And even when some of the hair does grow back, it's much finer and much easier to deal with just a touch-up or even just shaving at that point. You're going all the way through the skin. You're not targeting the surface or even the surface hair. It goes right down to the root of the follicle where the pigment is. And that's what we're knocking out. By killing that, you're killing the hair. The hair will not grow back. And every time you do it, you get more permanence. Plus, you're doing one hair at a time. With the laser, I'll do this whole section in one shot. And that'll get rid of it.
What parts of the body does it work best for?
So my favorite places, most rewarding, are the underarms, bikini, lower legs. The coarser the hair and the darker the hair, the better it works in fewer treatments. So it's great in all areas, but those are the best areas.
You comfortable?
Sure. Well, don't close your eyes because you'll miss it. You can close your eyes if you like, but everyone else, don't close it because you'll miss it. It's just pulling the hair up, and that's it.
That's it?
It didn't hurt at all.
Are you serious?
Yep.
I don't smell any burning. There's nothing.
Nope, nothing.
I expect
And
a
one
charred
more.
skin here. Why are we not even
And
smelling?
you hear the click of it. You can see minimal redness, but 3 shots, her whole underarm is done. That's the end of it.
You've got to be joking.
It didn't hurt at all. I know. It's that good, that easy, and that fast.
But not all the hair fell out, so.
It won't. It'll come out over the next few days. So as she shaves, she can go forward, just get on with her life, and the hair will just be gone, and it just won't come back.
And how many times does she have to have the therapy administered?
Anywhere from 4 to 8 times, ideally at 1-month intervals. We go with the hair growth cycle. So underarms probably at a month. If the hair grows back slower, you can go at 6 or 8 weeks. But you do have to be regular about the treatments to get the best results.
Tattoos are designed to last a lifetime, but what if you don't want to keep it that long? Luckily, there's a way to remove it with lasers. Here's how it works. The second the tattoo ink penetrates the skin, your immune system sounds a red alert. White blood cells rush to the injection site to inspect the intruder. Tattoo ink is often made of heavy metals that your blood cells can't recognize, so they immediately start attacking it and escorting it towards the exit, your kidneys. But there's a problem. Your blood cells are minuscule in size compared to ink droplets. It's like a human trying to move a gigantic boulder. Your cells can rage war for decades, but the tattoo will remain intact. That's where the laser comes in. Energy from the laser acts like a giant sledgehammer. It heats up the ink in your skin, breaking ink droplets apart into smaller pieces. Now the ink is easier for white blood cells to carry away.
Sarah, you're here today for a particular reason. What's that?
I have an ugly tattoo on my neck.
So you're ready for it to be G-O-N-E, gone.
Yeah.
Well, Dr. Kirby, you've seen the tattoo and you say it's a good candidate for removal.
Sarah's come to the right place. She is a great candidate for removal, and I'll tell you why. It's upper extremity. The neck is very, very vascular. Do you want to have a seat here, Sarah, and we'll take a closer look? And she also has a fair complexion like myself, so black ink tattoos on the upper extremity tend to do really, really well.
And so if anyone's thinking about getting a tattoo and they're not sure they're going to want it forever, you're saying black's actually a good ink to use?
100%. It's not that intuitive, but you should definitely choose black color because that's the easiest for dermatologists to remove.
All right.
So Sarah, you ready?
Yes.
So we're going to get started here on 3. Bear with me 1 second. 1, 2, 3. Here we go. You doing okay there, Sarah?
Yeah.
So bear with me, you're doing great. Now the clinical frost you see here, that change in color, I'm absolutely thrilled by that. I mean, Sarah is getting nothing short of a phenomenal reaction, and that's actually the lysis of the ink bonds. The ink is carbon-based, and when you see that frosting, we call it, that's actually the breakdown of the bonds. That's carbon dioxide being released. That's correct. The carbon dioxide gas, it will just dissipate into the environment, We're more than halfway done, Sarah. Bear with me. You're doing wonderfully.
And so this is essentially laser technology.
5, 4, 3, 2, 1, 0. Sarah, I'm all done torturing you. I'm applauding you, Sarah, because, you know, I've never had a tattoo removed, but I know those lasers, hey, they do their job by penetrating the skin. The result she has there is exactly what I love to see. See beautiful frosting. You can see the ink dissipated already. She needs multiple treatments, but I think she can rest assured that she's going to have 100% normal skin. So, Dr. Travis, can you hand me that aftercare cream there? Of course. Thank you very much. We're going to put just a little bit of this on here, and we're just going to take good care of this after the fact. I always tell my patients 50% of tattoo removal is what I do with the laser, and 50% is how well they take care of it after they leave here today. Sarah's going to be a great patient and do a phenomenal job at home. So I'm extremely confident that over the next few weeks to months, she's going to get a great result.
In close-up, we can see the pigmented areas are caused by excess melanin deposited in the skin cells, and we can treat these areas selectively with long-pulsed laser energy. As we look even more closely, we can see the pigment in the skin cells selectively absorbs the long-pulsed laser energy. The melanin is damaged with sequential laser shots, but without damaging the surrounding normal tissue. As a result, the skin's repair process removes the damaged melanin, restoring normal-colored skin to the treated area. Here we have pigmentation at baseline and after a single session. The significant improvement is clearly illustrated. Small but obvious blood vessels are a cosmetic problem. With a smaller spot size, the long-pulsed laser energy penetrates through the skin and blood vessel wall and is selectively absorbed in the hemoglobin in the blood vessels, creating a superheated steam bubble in the target blood vessel. As the bubble collapses, it creates a vacuum, drawing the vessel walls together, coapting them, and closing off the vessel. The treated blood vessels naturally disappear, giving excellent results with normal skin texture and normal skin color. Clinical findings at baseline and after treatment, as seen here, illustrate very clearly excellent clearing of the target vessels with normal skin condition. Skin rejuvenation is a very powerful non-invasive indication. In this area here, we can see fine lines and wrinkles and enlarged pores with tired and poorly organized collagen and elastin fibers in the dermis under a thin epidermis. The long-pulsed laser energy reaches deep down into the dermis, gently heating up the age-damaged fibers and starting the skin's healing process. This in turn activates the fibroblasts to synthesize new collagen and elastin, as seen here, plumping and tightening the skin. The long-term remodeling phase completes the process, turning back the clock for the skin cells and the collagen fibers, so that over time, lines and wrinkles are removed and pores become smaller.
Welcome back to WBRZ News 2 at 4. Dr. Z is here today to talk about a procedure called a laser peel. So what is this?
Dr. C at Christmas.
Okay.
It's Christmas.
Sure,
Dr.
why not?
C. Mr. C. Well, a laser, yeah. So I have a new office, and we have a new laser. We have a few new lasers. I've been out canvassing the globe looking for new lasers, and one of the new ones we have is called an erbium laser. Erbium is the wavelength, 2940 nanometers, and what is it good for? Well, it's one of two ablative lasers. Ablative meaning that it actually vaporizes the skin surface. Some people call it a micro laser peel, a laser peel, a nano laser peel. It comes by different names. And the key is you can dial in your depth. So if you only want to go very, very shallow, there are different levels, and you can have it done on a Friday, and it feels like a sunburn, and you're good to go on Monday. You have your glow back. And a lot of people, especially in Hollywood, and they want to just maintain. They don't want to do anything drastic. At least I think they shouldn't want to do anything drastic. It's better slow and steady. Less is more is my motto. And here's some pictures. So this is someone who's had one of those peels, and you see laser peels, that the pigmentation, the uneven pigmentation is a lot better. And if you look at the wrinkles, the fine lines around the corner of the eye, we call those the crow's feet, that's improved. We should have another one. Again, it gives you a glow. It gives you your glow back. Fine lines, wrinkles, texture. You can do one. You can do one a month for 3 months to get your skin back where you want it to be. And then your maintenance, you may do one twice a year. It just depends on what you want to do. And the good news about it is you can do it on other body parts too.
I was wondering if it was just your face or if it's your arms.
No, you can actually, I've done it all over the body, so you can do different body parts. Now the good news is don't have much downtime, and the cost isn't that bad either.
And how long does it last?
Well, it sets back the clock,
okay,
and the clock starts ticking again. The good news is it stimulates collagen, so you're doing something to get your skin more healthy. Not only does it look better, it's going to look better down the road. Wear your sunscreen. So as long as you protect your skin, it's going to last a long time.